In this week's Cardiology Countdown, we have two studies on AFib and one on exercise. So beginning at the number 3 spot, we have a meta-analysis of 33 studies that looked at different doses, so to speak, of exercise and found that those who meet the guidelines, as I try to, exercising 150 minutes per week, that would be 5 days a week, 30 minutes a day, had a 14% lower risk of cardiovascular events. And those who exercised more, greater than 300 minutes, that would be an hour, 5 times a week, had a 20% lower cardiovascular risk. And so these new data from the meta-analysis support the current guidelines and say more is better if one can. At the second spot is an analysis from the Pinnacle Registry looking at the current use of warfarin for atrial fibrillation. This was an analysis at 20 practices looking at over 9,000 patients. And as has been seen in other studies, even amongst those who had a CHADS risk score of 2 or higher with a clear indication for warfarin, only about 50% of patients were receiving warfarin. Of those that were not, the majority were receiving aspirin, but still a third of the half of patients, so a sixth overall, were receiving no antithrombotic therapy whatsoever. And so this also identified a lot of practice variation amongst the practices where use of warfarin overall ranged from 25 to 80%. And so this illustrates the way a registry can identify opportunities for quality improvement. And then at the number 1 pick this week is the publication of the ROCKET AFib study, and this looks at the new oral 10A inhibitor rivaroxaban as compared with warfarin. As previously presented but now published, rivaroxaban was non-inferior for prevention of stroke or systemic embolism as compared with warfarin. The event rates were 1.7% versus 2.2% in the primary analysis, and this had a P of non-inferiority of less than 0.001. In the intention to treat analysis, the event rates were 2.1% and 2.4% per year, and so not superior by statistical testing. Overall, the risk of major bleeding was similar, although the rate of fatal hemorrhage and of intracranial hemorrhage were significantly reduced by about 30 and 60% for intracranial and fatal bleeding. And thus, a potential new option, not currently approved, but under review by FDA. So with this week's Cardiology Countdown, I'm Chris Cannon.